Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department with our weekly COVID-19 update. The numbers remain relatively stable, and Dr. Bogan's going to give the update. One of the things that we're seeing, and Dr. Bogan has really been ahead of the curve talking about this over the last couple of weeks, and we hear that today was reiterated by Dr. Redfield from the CDC and Secretary Levine at the State Department, but a lot of the cases seem to be happening in backyard or familial gatherings of friends and family members where people feel comfortable. And that's one of the things we want to continue to reiterate is wearing your mask and social distancing still matters no matter where you are, even in your own, with your own family and friends. But you know, the good news is we continue to have great level of cooperation. We had talked last week about, the first professional sports game that was going to be open, and I really got to credit our Steeler fans. I watched it on TV and I think every person I saw was wearing a mask, so thank you. And when I watch some of the other venues around the country, it's not so good on the mask. So I think people in Pittsburgh and Allegheny County, really listening to our health professionals, knowing that we can do activities if we do them safely and we do them vigilantly with our masks and the distancing and all the things that we've been learning over these last number of months. I also want to do another reminder about, talk about safe operations. Elections coming up, less than 3 weeks away. The mail is safe, the mail is reliable. So many people have already done it. Over 370,000 people have already applied, and I think almost 200,000 have already sent their ballots in to be voted. So again, it's another activity that we can do to participate and do so safely. And then the last thing is to remind people tomorrow is the last day for the census. You can go ahead and make sure that you're counted. We want to make sure everybody is counted. We're now over 72%, and that does exceed what we did 10 years ago when we got 70%. So again, level of cooperation, doing things safely, doing things in a way in which all of us can keep our numbers low. And with that, I want to turn over to Dr. Bogan. Dr. Bogan.
Good afternoon, and thank you for joining us today. So although our numbers have generally remained below 100 cases per day, there has been a slow and very gradual increase in the cases reported to the health department over the past few weeks. So if you consider the last 6 weeks, from the beginning of September until today, the average number of new cases has increased from about 68 cases a day during the first 2 weeks of September to 69 cases during the last 2 weeks of September to about 79 cases per day from the beginning of October. So it's not a surge like we saw over the summer. The numbers aren't doubling each day like we saw at the end of June. And I attribute this slow increase to the general opening up of activities in the region. More attendance at weddings, funerals, parties, school activities, going to restaurants, etc. And the rise may be slow and not rapid in our community because people here are wearing their masks. According to information from Carnegie Mellon University's Delphi Research Group that gathers data from Facebook surveys, about 93% of people in Allegheny County report wearing face masks when out in public most or all of the time, which is higher than our surrounding communities. But we don't want to ignore this creep of cases upward. This slow increase should remind us that things aren't getting better in Allegheny County, but they also aren't getting substantially worse as they are in other parts of the state or the country. So I am glad that people are getting out, but I ask that you continue to do so with safety of yourself and others in mind. Remember, I am not asking you to stop being social, but rather I'm asking you to be social differently, in small groups, with face coverings, outside as much as possible, and physically distanced. Now I'd like to share the data we've collected to date about cases of COVID-19 in the county's child care programs and schools. So since August, there have been only 27 cases among children and staff at child care centers, divided roughly equally between staff and children. Since August, we've had about 450 cases at colleges and universities, and those cases span across 12 of the county's different colleges and universities. Since the beginning of September, there have been about 150 cases of COVID-19 among students in kindergarten through 12th grade, and another 60 cases among teachers, coaches, or staff members. And these cases span more than 100 different schools in the county. There have been cases both at public and private schools, at elementary schools, middle schools, and high schools. The good news, what we have not seen is an entire class test positive or other indications that the virus is spreading broadly among students while they are at school. What we have seen is that students on the same sports team or in the same band test positive. However, our case investigations suggest that most of these cases interacted socially outside of the game, practice, rehearsal, concert, or activity. It appears more likely that the virus is spreading at team dinners, at sleepovers, at play dates, and at parties. Like weddings and funerals, the stories we hear from students are situations where folks relax the rules around wearing masks, keeping their distance, and washing their hands. We see that as people are comfortable with one another, they feel safe and let down their guard. Overall, I am very proud and very appreciative of the hard work students, parents, teachers, staff, and administrators have put in each day to keep one another safe at school. It's important to take the same precautions before and after school as you do during school. And this above advice goes for all of us. What we've seen during the past several weeks is that we are pretty good at following COVID safety precautions when we are around people we don't know. We're pretty good at wearing masks inside stores, in crowds both inside and outside, and wherever we're close to people we don't know. We keep our distance, we wash our hands, we use hand sanitizer. But we're not so good at keeping that up when we are around people we know well. Last week alone, 15 new cases reported going to weddings and 20 reported going to parties. So you can do these events and gatherings safely, but it takes a conscious effort. Wear your masks, keep your distance, wash your hands, use hand sanitizer, and don't let your guard down. Just a few reminders. First, the McKeesport Community Testing Site has been open now for about a month and remains open. We've seen an increase in the number of people getting tested there in the last week. And so far, we've tested over 1,100 people, but we can handle over 200 a day. So if you have symptoms or you're a close contact of a case or you're worried you were exposed, please register online for a next day appointment or call 412-209-2262 for a same-day appointment, or you can register on site, although on-site registration is not our preference. Our test positivity rate at the site has been about 3.3%, and that's compared to the county overall positivity rate of 3.7% reported on the state dashboard. I want to remind you the testing site is open until 7 p.m. tonight and will be open from noon to 7 p.m. tomorrow. It will be open from 10 a.m. to 4 p.m. on Friday and Saturday. We will continue to have evening and weekend hours next week as well. Second reminder, I encourage you all to sign up for the COVID Alert PA app. So far, nearly 300,000 Pennsylvanians have registered for the app, and I especially encourage those living in communal housing situations, universities, or taking public transportation, or work in jobs that engage the public. It will be very helpful for those people particularly, but anybody, to see if you've been exposed. And third, my final reminder, please get your flu shot. We have already vaccinated more than 1,000 people at our county's vaccination clinic. We have plenty of vaccine. There's vaccines at pharmacies and at your primary care providers' offices. So again, please go get your flu shot. And again, thank you for joining us. Please be safe and be kind.
This first question is from Public Source. In the days between September 26th and October 3rd, Pennsylvania had 6,812 COVID-19 cases, 52% of which had an investigation started within 24 hours. Can you tell us what the success rate is for county tracers?
Sure. So last week we had about 560 COVID cases here in the county, and about 2/3 of them, the investigations were started within 24 hours, and nearly all were started within 48 hours. And we're looking into some details about what sort of predicts who gets contact within the first day.
This next question is from KDKA. In your remarks, you mentioned that Allegheny County is starting to see a rise in COVID cases. Will the county plan on implementing any other mitigation efforts if we see a resurgence? And if so, what kind of mitigation efforts would you consider?
As I've said all along, we follow the science and we follow the case investigations. And those case investigations tell us what we need to respond to. And I will continue to use that as the guide for any future mitigation efforts.
This next question is from the Tribune Review. Would you comment more broadly on how nursing homes in the county are responding to the virus? We're wondering if county officials would consider this a second wave of nursing home outbreaks, and if they think facilities that haven't had cases are vulnerable. As a follow-up question, what kinds of things should those facilities do to prevent outbreaks, or what lessons have been learned from the spring?
We are definitely keeping an eye on our long-term care facilities and our nursing homes. As we've seen in the past, the cases in nursing homes tend to trail behind the cases we see in communities. So if we see a rise in community cases, a couple of weeks later, we'll see a rise in nursing home cases. So again, we have seen sort of a smoldering of outbreaks here, but they've been kept generally small, but we're keeping a very close eye on that. I think what's worked really well is really the state put in place that program called RICP that has been very helpful. They do on-site visits with nursing homes. They provide PPE and testing. And all of that combined, I think, has prepared our nursing homes better and been able to stop outbreaks more quickly. And I think, again, we've all learned as a country and as a community how to respond to those outbreaks, and in general have been doing a very good job at that.
And one additional follow-up question. As facilities reopen to visitation, do you worry about more transmission?
The criteria for opening up are very strict and relate to cases in the facility. So again, we'll keep a very close eye on what happens as those policies change.
This next question is from WTAE. Fans were allowed in the stands at Sunday's Steelers game for the first time. From what you observed, were adequate safety measures followed, or are there any changes you would suggest?
So unfortunately, I did not see the game on Sunday, but I've heard from good and reliable sources that the fans really did a great job and that the procedures seem to have worked well.
This next question is from the Pittsburgh Business Times. Have there been any indications of spread of COVID-19 from large-scale events here in Pittsburgh? I'm thinking of the president's visit at the airport a few weeks ago, but any others that you might be aware of that people should know about?
Not that we have seen or noticed in particular. So it's too early to see any effect from a Steelers game, for instance. But again, the policies there, people are very spread out. People are wearing their masks, and it's outdoors, so very unlikely. In terms of the rally, that part of the problem is we only get cases that come from the county. So I believe that there were a lot of people at that rally that were from out of our county, and again, we would not have that case information. We only get information about cases from our own county residents.
This next question is from WESA. The Pennsylvania Department of Health announced today that it would begin distributing rapid antigen test cards. Antigen tests produce results within minutes, but are less sensitive or accurate than PCR tests. For this reason, how helpful will these tests be in identifying coronavirus outbreaks?
I think there are, every test, you need to sort of use it appropriately. And we are sort of really carefully considering where the tests would be used and how they would be used and in which populations based on their sensitivity, specificity. And so that, I think, again, it's very important to use them appropriately, and there has been some guidance put out by the state around the use of the antigen tests, and we will continue to use that guidance and to look to new data as it's published about the best way to use them.
This next question is from Public Source. Multiple studies have shown the strength of the anti-vaxxer movement in the Pittsburgh region. How will this impact the push for residents to get a flu vaccine this season?
It won't. We know that most people in the United States actually trust science, and the science behind vaccines is strong and completely irrefutable. I know there was a Pew Research Center survey a number of years ago, even last year, I think, that showed that about 86% of Americans say they trust, at least to a fair amount of confidence, in the scientists to act in the public interest. So, you know, I think we let the anti-vaccine movement really drown out the quiet majority in our country. We know that in Allegheny County, over 95% of all of our children are fully vaccinated by kindergarten. And that number speaks volumes to the acceptance of vaccines in our community, and really the trust that the public puts in us around vaccines. So we've been looking at vaccination rates, and we know that we have already been vaccinating at much higher rates than usual this year. So for instance, we have vaccinated over 1,000 people this year already at our county health department vaccine site, which is more than we vaccinated all of last year. So there's a huge demand in pediatric practices and across the county for flu vaccines. So again, the request for vaccines this year we expect to be extremely high, and we don't expect really a big denial of the vaccine.
And this final question from KDKA, is the county seeing any signs of flu cases yet?
We have had, I believe, one reported case so far, but it's quite early. We tend to not really see flu cases pick up in the county till November, and even sometimes as late as December. And so we haven't started a lot of testing either. So just one case so far that I'm aware of.
That was the final question, but I did have a comment passed on by the member of media telling you that they love your scarf. So just to pass that on. So if there's any final comments.
Thank you, Dr. Bogan, and again, thank you for the team that you put together and everybody working diligently to keep us safe. The advice is so sound, and we know what we need to do, particularly now as the weather gets cool and more and more people will be going indoors. It'll be even more important that we wear our masks, keep our distance, etc., wash our hands, use hand sanitizer, and all the things we know what we need to do during this time. So again, everybody stay safe, have a good week, and